What is the Center for Medicare and Medicaid Services? The Center for Medicare and Medicaid Services, or CMS, is a federal agency within the United States Department of Health and Human Services. CMS is primarily responsible for the administration of the Medicare program across the United States. CMS also works in partnership with state governments to administer Medicaid, the Children's Health Insurance Program, or CHIP, and health insurance portability standards. In addition to administering these programs, CMS is also responsible for the regulation of the administrative simplification standards put in place by the Health Insurance Portability and Accountability Act of 1996, or HIPAA. Quality standards of long-term care facilities such as nursing homes, clinical laboratory quality standards as directed by the Clinical Laboratory Improvement Amendments, and the oversight of healthcare.gov. In 1965, President Johnson signed into law the Social Security Amendments, which established Medicare and Medicaid. Originally called the Bureau of Health Insurance, this new program provided health insurance to over 19 million Americans via Medicare. In 1977, the organization was renamed the Healthcare Financing Administration, or HFCA, and became responsible for the administration of both Medicare and Medicaid. In 2001, this agency became what is known as CMS. The primary responsibility of the CMS is to administer Medicare to the American people. All those over the age of 65 and some under the age of 65 with certain disabilities qualify for Medicare. Medicare has different parts which help to cover specific services for patients, including hospital, outpatient, and prescription drug charges. Medicare is directly administered by the federal government through CMS. CMS produces fee schedules for physicians and hospitals on a fee-for-service basis to determine physician and hospital compensation for different services rendered. In addition to administering Medicare, CMS plays a role in the administration of Medicaid as well. Medicaid, unlike Medicare, is at least partially funded at the state level. However, the CMS is responsible for the regulation of Medicaid, including enrollment standards and payment schedules. Medicaid is a means-tested, needs-based program where eligibility is largely determined by income. While Medicare is administered based on age, Medicaid does not have an age requirement for enrollment. The Centers for Medicare and Medicaid Services, or CMS, provides health coverage to more than 100 million people through Medicare, Medicaid, CHIP, and the health insurance marketplace. The 1996 HIPAA, 2009 Health Information Technology for Economic and Clinical Health, and the Medicare Access and CHIP Reauthorization Act, or MACRA, have all greatly expanded the role CMS plays in the practice of medicine in the United States to ensure not only access to care for the nation's elderly, disabled, and impoverished, but also expand the use of information technology through programs such as Meaningful Use Program, as well as develop new models of compensation that reward high-quality care, such as the Merit-Based Incentive Payments System, or MIPS.